Hello, I am Jeffery Snyder, and I am a cardiothoracic surgeon at Capital Regional Medical Center. I knew from an early age, about the time I started high school, that I wanted to be a physician. No one in my family is a physician, and I suspect it came from watching television shows. I knew from the very beginning that I wanted to be a surgeon. I like to do things, and the fourth year of medical school was when I did a rotation on a cardiac surgery service, and from that day forward, that's all I ever wanted to do. I moved here for two reasons. The hospital wanted someone to do more surgery here at this hospital along the lines of what I was doing in Gainesville, and my two daughters moved to this area, so if I didn't move here, I was probably going to be in Gainesville by myself. Quality of care is really important to me, so in the things that I do, I have to maintain the highest quality possible, and we are measured against the national benchmark constantly. So if we are not meeting the level of quality that we should, we know that very quickly and can do things to improve upon that. Fortunately, my record and my quality scores are above the national average, and I do intend to keep it that way. And then quality in the hospital with the care that is given after the surgery is over is very important. And again, we are doing an excellent job in that regard and getting people over their operation and out of the hospital and back to a high level of functioning very quickly and very efficiently. The best part is taking someone who's very sick with complex medical problems that are life-threatening and bringing them through an operation, and then seeing them in the office for their follow-up and seeing how much better they are, and knowing that their life will be prolonged as a result of what we do. I think the hands-on personal experience that I provide is unique, and I have heard that in all the years that I've been in practice. People appreciate the time that I spend with people, explaining things, answering all their questions, and the time to talk to family. There are a few patients that I have had the opportunity to do surgery on them and gotten to know them after their operation is over and their follow-up is complete. And I still maintain contact with several of them and actually go fishing fairly regularly with one who has been a great friend over the past 20 years. A lot of times I see people and they will say, "Hey, Dr. Snyder, remember me?" And unfortunately, I'm not very good with names, but I remember their faces and usually what we did for them, and that is very gratifying. I still get cards and letters from people who I did surgery on months and years ago, and they tell me how well they are doing and what a big difference it's made in their lives. And that is the most rewarding thing that I do.